Good afternoon. Speaking today on the territory of Treaty 6, and I recognize the Métis people who share a deep connection with this land. Joined today by Dr. Notley and our leader, Rachel Notley. Dr. Ryzantsoff is a family doctor and has 2 children with diabetes who use insulin pumps. She brings both her medical expertise and her experience as a parent to talk about the importance and the impact of an insulin pump. On May 3rd, the UCP suddenly announced they were canceling Alberta's Insulin Pump Therapy Program effective August 1st and justified it by saying they needed to cancel the entire program to make newer technology more accessible. This gave only 3 months for people who rely on the program to figure out how they could continue to afford and keep their pump. I can tell you my office was immediately hit with a wave of emails, phone calls, and messages from distraught Albertans whose lives were about to be plunged into crisis by this government. Well, thankfully, the diabetic community spoke loudly and clearly. We heard them as we called on the UCP to halt their plans to cancel the program and enter into meaningful consultation. And on May 12th, Minister Jason Copping said that he would pause the implementation of these plans and consult with the community. And that should have been good news. But unfortunately, in the months since, the UCP have done very little to actually consult with the community. They've held 1 telephone town hall, which created more questions than answers. Many of the people who attended felt it was just an attempt to justify scrapping the program and not a sincere consultation. People with diabetes are worried that this is simply a plan to delay the cancellation of the program, a plan that puts Albertan families at risk, and that is unacceptable. So I'll now turn things over to Dr. Ryzantsoff, who will explain a bit more about diabetes and why the pump is so important for her family, and so many other Albertans. And she will also share her experience from the UCP's limited consultation. Dr. Ryzantsoff.
Thank you for having me here. My name is Dr. Notley Ryzantsoff. I'm a family doctor, and I'm mother of 3 boys. 2 of my sons were diagnosed with type 1 diabetes, both at the age of 6. They are now 7 and 9, and both on the Insulin Pump Therapy Program. So type 1 diabetes is a condition where your own body attacks and kills the insulin-producing cells in your pancreas. Insulin is a hormone responsible for regulating our body's blood sugar. The cause of type 1 diabetes remains unknown, and at this time, there is nothing we can do to prevent or cure this disease. Without these insulin-producing cells, we have to take on the difficult task of regularly monitoring blood sugar and giving insulin carefully matched to blood sugar level, food intake, and activity. There are immediate and life-threatening consequences of having blood sugar go too high or too low, including seizures or coma, as well as many complications that can result from prolonged high or low blood sugars. Type 1 diabetes can be diagnosed at any age, but the majority of cases are diagnosed in childhood, adolescence, and early adulthood. Management options for type 1 diabetes include insulin injection therapy and insulin pump therapy. Insulin injection therapy consists of multiple insulin injections given throughout the day. An insulin pump is a computerized device that infuses insulin through a small plastic tube that goes under the skin. There are many advantages of an insulin pump. A pump gives you the ability to give insulin discreetly and without a needle. It can calculate the appropriate insulin dose for food intake and can deliver smaller doses with greater accuracy. There are many more options for adjusting insulin doses, which help improve control and prevent low blood sugar. Schools and daycares are more comfortable giving insulin through a pump, which can enable parents of children with type 1 diabetes to work outside the home. With insulin pump therapy, your insulin is tailored to your life instead of your life being constrained by your insulin. There is growing evidence to support improved control, improved quality of life, as well as decreased rates of complications on insulin pump therapy as compared to insulin injection therapy. The Insulin Pump Therapy Program is a program that makes insulin pump therapy a reality for all the people of Alberta with type 1 diabetes. This program was stress-free and easy for both patients and their care teams to navigate. The proposed changes to the insulin pump funding were developed without any consultation with the people that use it and with minimal input from their care teams. The fees and copays that will be required to continue to use an insulin pump if the proposed changes go through will make insulin pumps unattainable to some and difficult to access for many more. Type 1 diabetes is a burdensome and expensive lifelong condition. Families of those with type 1 diabetes not only have to carry the cost of medical supplies, but they also put in countless extra hours of work measuring, counting, planning, calculating, and adjusting to manage their condition. Adding an additional $1,600 bill per family per year to keep one family member on an insulin pump is not something that all families or individuals can afford. Most of these families are already paying premiums for plans to cover insulin, other medications, dental, and vision care. So the imposed changes would result in families having to pay 2 premiums per month if they want to continue on an insulin pump. It is misleading that the changes to insulin pump funding were initially presented as a positive change to those with type 1 diabetes, when in actuality they are designed simply to transfer costs from the government to the patient. The newer technologically advanced pumps that have been mentioned over and over are not advanced unless they are integrated with a continuous glucose monitor such as Dexcom, which is not covered for most Albertans and costs over $3,000 a year to use. There are no increased costs to the government in increasing the availability of similarly priced pumps. On May 12th, it was a great relief for many to hear that the Insulin Pump Therapy Program cancellation was on hold for further consultation. However, the most recent consultation on May 19th did not reassure those of us that rely on this program. Notification of this meeting was not distributed widely, and there was minimal notice provided. The structure and timeframe of the meeting limited opportunities for attendees to express their concerns, and it was widely felt by those who attended that their concerns were dismissed or ignored. Many of the answers provided by the government implied that this program was going to be cancelled regardless of this consultation. I am not aware of any further consultation meetings scheduled at this time. The Insulin Pump Therapy Program, as it stands today, is a life-saving program. The changes suggested have huge possible harms and do not actually amount to savings. These changes will likely result in increased costs to the taxpayer in the form of increased emergency visits, hospital stays, and disability from poorly managed diabetes. The government is ignoring evidence that demonstrates that models of copay reduce quality, access, and equity of care and do not reduce overall health care spending. I believe that a strong insulin pump therapy program and expansion to cover continuous glucose monitoring for all will decrease costs to the healthcare system in the long run. I am hopeful that those affected by type 1 diabetes will be heard and will be supported, and that no one will be forced to give up their insulin pump or to take on the substantial cost to continue their choice of therapy. Thank you.
Thank you very much, Dr. Rezansoff, and thank you, David, for your comments as well. It is truly clear that the UCP's plan to scrap the insulin pump therapy program will harm Alberta families, and that's not okay. The Albertans who rely on this program for their quality of life and their safety have spoken up, and I'm grateful that we were able to help deliver their message to the government, but it now appears that the UCP still isn't listening. My heart goes out to all the families who've been on a roller coaster of uncertainty and anxiety over the past few weeks. And I want to quote briefly from a letter that was sent to the UCP Health Minister by Diabetes Canada in regards to his plans to scrap the program. And I quote, "In some cases, it may force Albertans to make difficult choices between paying for needed diabetes drugs, devices, and supplies, or paying for necessities like rent or food. Putting Albertans in these situations, especially for healthcare costs, is just totally unacceptable, especially given the many other soaring monthly costs that the UCP has imposed upon Alberta families." So, what's the solution? Well, an NDP government would handle this very differently, but I'll get to that in a moment. My preference actually is for this question to be settled very, very quickly. Albertans living with diabetes shouldn't have to wait or endure months more of uncertainty or wait for the outcome of an election. There's a simple path forward, and I hope that Jason Copping and the UCP will consider taking it. Let's start then with a commitment to these 4,000 or so Albertans that nobody is going to lose what they have or be told to pay more. No more new costs, no switching to insurance plans, no switching to new insurance plans, no changes to the access that Albertans have today for current or future patients. And then, only then, once they've gotten that clear guarantee, can we then have a conversation meaningful conversations, ones that allow for give and take and sharing of experiences between those families that need this particular important life-saving medical care and administrators who are looking at coming up with new processes. Let's have real consultation with the communities that this program serves and actually listen to what these folks and their families need. Now, as I said, my preference is for the UCP to take this advice and immediately make this commitment so that nobody will lose access to what they have, nobody will have to pay a penny more, and no one will have to spend any more time worrying about that. In the event that the UCP refuses to do this, then yes, an NDP government will make that commitment ourselves, and we will commit to protecting the insulin pump therapy program in its current form and starting a conversation about how we might be able to make it better for families.